Coming up today, parents share what scares them most about Halloween. So do pediatricians with a list of Halloween do's and don'ts for kiddos based on their age. Plus, can adults really scare themselves to death? These answers and more as we look toward a safe night of trick-or-treating. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. We have assembled a panel of experts to remind us that Halloween, it can be fun if we set ourselves and our kids up for success. People of all ages enjoy this annual day of dressing up, going to parties, giving, and getting candy. It's all fun and games, though, until someone gets hurt. Over the next 30 minutes, we're going to offer expert advice for staying safe throughout Halloween week. We'll hear from two specialists, Medical Director of Inpatient Pediatrics and Pediatric Intensive Care, Dr. Michael Lewis. Hi.
Hello.
Good morning.
Good morning.
Thanks for playing along.
You bet.
He's here in studio to give us insight with about some of the most dangerous parts of Halloween for kids. So we're going to hear more about that. Pediatric child psychologist Dr. Stephen Lassen. He's going to help us distinguish between what's fun and what's more frightening for children of different ages and those with special needs. And across from me, we know Halloween is a busy time for the Poison Center at the University of Kansas Health System. Managing Director Dr. Elizabeth Silver is here to share what contributes to that increase in calls that you guys receive. So thank you for being here for that. And for all of those who like to scare and like to be scared ourselves on Halloween, interventional cardiologist Dr. Dusan Stanojevic explains the risks of overdoing it when it comes to scaring. So, Grouchy.
Hi.
Hi. Okay, first of all, put your head down so we can see the googly eyes, which is the best part of this costume. How did you come up with this idea, by the way?
Well, it was spur of the moment. My wife and I went, and my kids had probably a little bit of thought process of what I should and shouldn't be. They probably said, "This might fit you, Dad."
Yeah, Dad in a onesie. I like this.
Yeah.
You're going to wear that well this week. I want to start, though, with a startling statistic, and I was really surprised because this is the thing that actually scares me the most. But according to data from the National Highway Traffic Safety Administration, Halloween is the deadliest day of the year for kids being hit by cars. Right. High-risk hours are between 4 p.m. and 10 p.m., and that's when twice as many children are struck and killed by cars while out trick-or-treating. It's no help that you have distracted drivers out in neighborhoods, and then you got kids running all different directions. But in a national Halloween survey, so surprised, few parents were worried that their kids might get hit by a car, and so they didn't really consider this a safety issue. That's the one thing I'm like screaming. My voice hurts by the end of the night where I'm screaming, look out for cars. But what are some simple things that parents can do to keep their kids from becoming any part of that statistic?
Well, I think part of it is that, you know, you need to make sure that your kids are visible, and that also that not only are they visible with something, because if they show up in all dark clothes and they have like no lights on them, no reflectors, somebody may not see them, but also making sure that they can see out of their own costume as well is a really big part of that. And so if they have no real vision, how are they going to be able to see if they're like just running and a car comes one way or another? And then, you know, people don't pay attention when they're driving. And so if you're in something that you can hardly move, you can't really get out of the way sometimes. There's some really awesome outfits out there, some of the big blow-up ones, but kids are barely able to manage walking, and so you can't really get out of the way.
And be looking out. I always tell my kids, cars aren't always looking for you. You got to be looking for them.
It's exactly it.
Always. And back in the day, remember we just had those simple masks with the big eyes. They were the worst costumes, but somewhat the safest, because now you have all this cumbersome material in the way. There's a trend, though, of parents driving trick-or-treating in different neighborhoods and then trailing their kids in their car instead of getting out and walking through the neighborhood. What's the problem with that?
Well, I think there's probably that a lot of those folks who are watching their kids, but how many of them are sitting there with their phones taking a video as they're going through, taking pictures, so they're not really probably eyes straight ahead, or sending the pictures once they have them to somebody from their phone. Everything is a risk because they're not really probably paying attention to driving themselves. They're just paying attention to more about their children.
And it seems obvious, but you see people driving with masks on. That's not a thing.
No. I mean, it's like, you wouldn't wear glasses that basically just put like blinders on you from here. So why would you do that when there's going to be more people running around out there too?
And speaking of masks, there's some do's and don'ts when it comes to safety. And we have some costumes that we want to show you. And
Yeah.
I want to know what looks good to you.
Got
Give
it.
us the thumbs up,
You bet.
thumbs down on
You bet.
if it's good or if it's an accident waiting to happen.
So this one right here, as you kind of see that little guy there in the back, he's kind of got the spaceman outfit on. He has like barely any ability to see out of that whatsoever. So his mom's holding his hand, but I would guess most parents would tell you they can remember when their little one maybe quit holding their hand and ran off.
Well, that's like you said. Yeah, that's good. That's a costume you're going to want, like parental supervision, not just
Yeah.
running from house to house, perhaps. Okay,
Yeah.
let's see the next one. Flippers.
Well, it is closed toe, so it might be OSHA approved, but it's probably not going to be the most agile outfit. So if somebody comes swinging in through that driveway right there or anything like that, she can hardly walk.
Yeah, tripping hazard, big
Yeah,
time.
yeah. And then this guy there on our right, as he's walking there with the kind of the ninja outfit, you can see on his legs, he's got really long kind of like straps or something come off his pants. Just another thing to get stepped on and fall.
And think about all these costumes that are halfway off by the
Yeah.
time Halloween. You know, kids are running
yeah.
around with half their masks
Exactly.
off because they're tired of, you know,
Yes,
having that pull
absolutely.
around. What is going on here?
Well, I'll give them credit. That's it's really creative. But you can barely see forward, let alone sideways. And Sue and us, we were talking earlier. You know, there's got to be seeds probably in there, so something gets stuck in a nose or an ear or something like that. And everybody's probably seen those alligator clips in the emergency room to pull stuff out of noses. So
No pumpkins, raw pumpkins on your head.
probably wouldn't do that.
Okay,
That's
gotcha.
that's
Check.
not a thumbs up there.
Okay, what do we got here? Let's see. Ooh, oh, the old-fashioned sheet over the head.
Yes, last minute, love it, but you can see he's already starting to step on it and everything. So again, it's just kind of a fall hazard, and so.
Well, the eye holes. I mean,
Yeah.
those are going to shift, and you're not going to be able to see. And
Yeah. Yep. So
Right.
I would say just being able to see, be seen, and being able to move around
I
safely.
have to say, I love Halloween, and so do my kids, but I like going before it gets dark. Because you know how they're really excited.
Yeah.
And so they're like, they come home from school, we eat a little something healthy before we go out, but we hit the road like by 5:30,
Yeah.
and so then it gets a little dark, but I think that helps too, and being able to
100%.
see. And
Yes, definitely.
all right, Dr. Silver, you're up. Glow sticks, makeup. These are common reasons that your phone rings over the Halloween holiday. What are the concerns there? What do you get specifically when it comes to those items?
Yeah, so they're very helpful when it comes to visibility, especially if you're not, going when it's light out. But
The glow
with glow
sticks,
sticks,
yeah.
yep, they're not immune to damage. They're very flexible, but they can be broken, and we get people that will bite into them. That can be irritating to the mouth, irritating to the face, to whatever body part it gets on. So it takes a thorough wash. And then makeup specifically, it should be approved to be used as makeup. A lot of that is like different face paints is what we really get.
Getting in eyes, kids rubbing their eyes.
Kids
and
will get it into
faces?
their eyes. Kids might eat it. Doesn't ever really taste good. And then we actually have had several calls about people that have used non-face paint, just regular paint,
Oh,
on
dear.
their faces.
Okay.
And so usually they realize, one, it's very hard to get off at that point, and it's very irritating when they're trying to get it off, and can also just be irritating being on the skin. So that's just important
Well,
to
and
check.
it sounds like things we should already know, but if you're still getting calls after all these years of these
Yep.
things, then, but I like the glows. I could see where a parent would think, oh, that glow stick, what a great idea to make sure my kid's visual, but you gotta keep an eye out. Okay, so is it okay to dress up? We see it's okay to have our adults dressed up.
Sure.
What about our infants and toddlers? They're pretty cute when they get
Well,
those costumes on.
I think that one of those is that if it's a lot of the times like the store-bought ones, they're probably not going to have like a choking hazard or something on there. So, but if they're kind of a homemade one, just be thoughtful of that. Like that's something that like a little kid might try to pull off, put their mouth to a choking hazard, and then. Also remember that if you're going to put your kid in, like a smaller kid, in one of those outfits, and it's going to make them a lot bigger, you're going to probably need to adjust their car seat as well, so they're not basically just like getting like restrained, like they can't even breathe in them.
Oh,
So.
the old car seat. Okay.
Yes.
Again, these are the little things you just don't think about when you go out and buy something. You're not
Yes.
thinking that far down
like
the road.
how am I going to get from A to B
Yes.
in that situation? It's like, well, you should be in the car seat, right?
All right. Also, candy. What do we do now with candy and food allergies? How do we keep our kids safe with that? Again, we were always taught, bring your candy home, let mom and dad look through it. But we know that kids get out there with their friends and they're, throwing candy in their mouth. What do we do about that?
I think there's a couple really basic rules, and this one's been there for, as long as I could ever remember. Go with sealed candy, not stuff that's probably been rolled. So there's that to begin with, because if it's been sealed, like a package of Skittles, M&Ms, Reese's Pieces, whatever that is, then that's going to be better than something that somebody could have maybe done something to that candy as well. So I think that's a big one. Also, if your kid has those food allergies, a lot of parents do an excellent job at educating their kids. If you don't know what's in that, don't eat that. That's probably a good reminder yet again, because as they're in the midst of a bunch of kids running around, if you have never seen that candy, don't eat it yet. That candy can still wait until you get home or something. And then the other is, you can never fully validate what is in something that somebody's made. There's a lot of creative people out there who love Halloween, and they make their own treats, so when kids come and they give them their own stuff, but those are probably things to most likely avoid.
Okay, good tip. All right, well, part of Halloween fun is the scare factor, as we know, but children react to being scared quite differently depending on their age or their needs. Here's what child psychologist Dr. Stephen Lassen recommends.
So we know that kids about 4 and younger really have a hard time distinguishing between fantasy and reality. After 5 or 6, they start to engage in more logical thinking. Getting costumes out and kind of showing that they're pretend, putting masks on, taking them off. Really helps them understand that what they're going to be seeing in Halloween is pretend. One is the change in behavior that can happen when we are dressed up. So when kids are dressed up as something else, they can tend to take on the identity of that person or thing. So kids who are dressed up as a zombie might have a more likely to jump out and scare people or act like a zombie, right? You're going to typically act like the thing that you're dressed up as. The second thing, though, is the anonymity that comes with being in a costume. And we know from a lot of good research that when we're anonymous, we have a tendency to act differently than when our identity's known. If you've got children who just don't tend to comply with directions as much, even though they might be a little older, you're not going to want to give them as much independence, perhaps. Anxiety is an experience of fear and anticipation, so really important for parents who have kids with a lot of anxiety that they structure the evening differently. They structure those activities differently, just knowing that there's a higher likelihood and risk for those kids to have a negative experience with it.
All right, any health risks to children being scared too much, too suddenly?
In the acute, right there in the moment, no. But I do think if you have a kid who might be easily scared, it's important to remember they might get nightmares. You're really going to impact their sleep.
That's exactly what I was going to say, right?
Yeah,
and not just. But that could be long term,
Oh, no.
several months after.
Definitely. We talk about sleep hygiene all the time in clinic, and then suddenly if you have somebody who you purposely scared them, and now they're anxious to go to sleep because they're scared to turn the lights off because of it being dark, or if now maybe it was really traumatic for them, or having nightmares and they wake up, that just impacts their entire day. And then so if they go to school and stuff too.
Makes sense. Well, we wondered what the safety threshold for fear is for adults. We all have friends and family who startle more easily than others or have heart conditions, but does that put them at more risk during Halloween? Here's what adults getting into Halloween spirit should consider, according to interventional cardiologist Dr. Dusan Stanojevic.
This would be theoretically possible, but exceptionally rare. They found out that he actually was having a problem with his heart stopping and pausing because he was being very upset and holding breath, and so his heart would stop. So this would be very unusual, and I don't think there is a real danger of something like that happening in most people on Halloween. There's definitely a difference between anticipated scare and something that just happens and you're scared all of a sudden. It's unexpected and how it affects your heart. The adrenaline that's released from the brain is much higher if something is not quite anticipated. They have done some studies that show that people that do high risk professions or professions that are very risky and kind of scary at times, they have a blunted adrenaline response. Also, people that are going to haunted houses during Halloween, they're anticipating being scared, so the chances of that affecting your heart are minimal, if none, versus if you get a real scared from something that's not anticipated, adrenaline can affect your heart dramatically. I don't believe there is any danger of really having your heart stop or having a heart attack. It would be unusual. I would argue probably that it's less common because you're startled easy. Probably you have some blunted response to adrenaline rush because it's happening more often. So I would say that they're probably not at very high risk, even if they have underlying conditions to be scared to death.
Dr. Stanojevic says that Halloween is the start of what he calls Santa Claus diet, which then can lead to what's called holiday heart. He says too much fatty and sweet foods, too much sitting around, too much alcohol. It poses more danger to our hearts than we often realize. Well, we've given you lots to think about, and we bet you have questions, so send those in using the chat threads on YouTube or Facebook. You can email the Medical News Network. That information is all right there on your screen. So, Dr. Silver, besides the glow sticks we talked about the makeup reactions, what other calls do you get over this holiday?
Well, we can't forget good old medications.
Yeah, so that was my next question.
Still top of the list. Obviously, children might be traveling. They might be going trick-or-treating with another family member. They might be going with a friend, visiting a friend's house. And so it's important that, in the home to keep those medications where children can't get them. Store them up and away out of sight. Kids are in candy mode, and there are a lot of medications that look like candy. So if they're in the house and they see something that they think, oh, this is a leftover Skittle or an M&M, when in reality it could be an iron tablet or something that just looks very similar.
Well, think of so many medications that come in gummy form now, so I could see those.
We have gummies, and I have to say I have to add edibles to the list.
Yep.
We know that they are very popular, so keep your edibles along with your medications away. They obviously will look like candy, like gummies, some of them very, very closely to even other brand-related things. So just keep those away so that there is a clear separation between medications, what's meant for the adult, and obviously what's meant for the children.
And that is the number one thing you get calls on? Still?
Medications still. Yep.
Still, gosh.
Number one.
Well, let's talk decorations, candles, dry ice, fun effects, but they can be dangerous. Any do's or don'ts from either of you? Any suggestions?
I would say definitely use your gloves or tongs to handle the dry ice. So some type of barrier, protective equipment. Before using it, you don't want to burn your skin, you don't want to burn your hands, and never put the dry ice in something that you're going to drink from, because you never want to accidentally swallow that. That can have pretty bad effects, very, very irritating. That's probably going to be a trip to the emergency room.
Yeah, then you got to see this guy.
Yeah.
Well, and that would be a problem.
That could be a problem. So let's go to some community questions, if we can. Cindy asked, what about sugar intake in general for kids? Tons of candy for Halloween. They were going straight into the holiday season. What does sugar do to those little bodies? Please say it's not doing something damaging, because I can't stand all the candy.
Well, I think it's, as was said earlier this morning, everything in moderation, right? So if you're going to sit there and you're going to go through and eat all of the chocolate that your kid brings home, or your kid does that night, I would expect that they're going to have an upset stomach and maybe throw up. But the reality is just, I think if you just use common sense, and rarely does every one of these kids need all of this candy, right? Like, there's a way that that candy is able to be kind of like gone through as the parent and making sure, hey, like, we do not need this much candy around, because it's right. Everybody just kind of sits there, and yeah, it's a small package, but then suddenly 6 small packages became quite a bit.
Now, my children will argue. They do think all of that candy is 100% necessary.
Oh,
but
well, trunk or treats have been such a big hit, you know, whether that's through your school or your place of faith. And so, like, we've done ours at our school and church. And my son, who's an 8th grader, he's out of it. He's like, oh, no, that's my candy. He's got like a registry, I think, on it at this point in time.
Right.
So yes, very possessive.
Very possessive, but I'm also a very mean mom, and that candy disappears somehow. And they're like, did you throw our candy away? I'm like, I did not. I don't know. I don't know. I don't
know if it's mean mom or you're making good decisions on their behalf.
Yeah, I just don't want to, I don't want to keep hitting up the dentist, you know, for years to come. Jeremy had a good question, though, because it is about trunk or treat. And if you have older children and have not experienced the trunk or treat phenomenon, which I love trunk or treat, it's instead of going from house to house at your church or work or school, parents decorate their trunks and line them up, and then kids get to just be safe in one big parking lot, and they're going from place to place, and you can run around and feel kind of a peace of mind.
The risk is very minimized.
Well, and that's what, but Jeremy always asks good questions. It's, you know, it seems safe, but are there any hidden dangers with that setup?
I think maybe if somebody just leaves their car running and you're just standing behind the car and just kind of breathing in the fumes from a car. But I think the reality is most of these trunk or treats have been done, and they've been very thoughtful, and so everybody lines up. Whether it's a horn for when the kids get out of the car, and then it's like a horn that goes off, everybody goes back to their car. So that way these kids are not running through the parking lot, because then the parking lots just suddenly become all this bottleneck and people coming out of there. But I think they do a really nice job just making sure kids are in the car before they let the cars start to leave.
I just wish that would take off everywhere. I know we do them a lot.
Yeah.
But it's just, I just wish that these would be a permanent thing. Dr. Silver, we were talking about candy. Do you have any rules at your house? What's the candy rule with you all? Or growing up, what do you remember?
So it was, we always would just get things we get from the store. That was our main thing with candy. I mean, we'd always try to get to the houses that had the full-size candy bars, because that was always the ideal, is trying to find the full size. Do I give out full-size candy bars? No.
No, you do not. Okay. Yeah. What do you give out? What's your candy of choice? Do you buy stuff that you like, or do you try to buy stuff you don't like so you don't eat it?
I do a little bit of both, and then I send them all the rest of the candy, like the mini, not like the mini size, but like the fun size, like Twix and Snickers. And a little bit of like the Twizzlers in there, and then when I'm done, I just give them to my husband, who brings them to work.
Good.
And then he just gives them away at the pharmacy.
What's your favorite Halloween candy?
Ooh.
What's your
I
go-to?
always liked Twix.
Twix are good. What about you? What's your number one?
Gummy bears.
Gummy bears.
Oh, yeah.
So do you buy them so you have some to stash?
My wife did buy them, and I saw like a 5-pound bag of them sitting on the counter this morning. So we're ready.
You're going to tear into those. My kids know that, like, I love the little mini boxes of Nerds.
Oh, yeah.
They know, like, just give mom her Nerds and she'll be happy. So I go through and pick. You go through and pick out stuff you like, the good stuff, of course.
I mean, I kind of forgot about Nerds until you just
right?
I think about them with Halloween, but
yeah, but they come in this perfect little size, and it's like a shot. You just take a shot of Nerds. It's amazing. So kind of talking about some of this, and you brought up this earlier, Dr. Lewis, but Patrick says he grew up with those fears of the tainted and tampered with urban legends of candy being tampered with. Is that really a thing? Is that really something parents should worry about? Are people really still like passing out, candied apples and popcorn balls? I mean, is this happening, and is it scary?
I mean, you might hear random, and kind of my thought process is, these are scenarios that nobody wants to have a coulda, woulda, shoulda. It only takes one, right? And whether it was something that was in there that your kid didn't even know, and they maybe have that they have a known reaction to whatever, and have anaphylaxis, or if it is somebody who was trying to, ruin somebody else's Halloween and is doing something to it, you never know. It's like a Monday morning quarterback situation, right? Like, we should have done that. So there's typically an excessive amount of candy all over the place. So just be wise, I think, with the candy that you take and don't take.
Well, and we kind of lose the insight, the fact that we're going from house to house,
Yes.
stranger to stranger, sending our kids up to someone's house and saying, give me something that I can eat.
Right.
And you're walking away with it. You don't, and sometimes you don't know these people, but yeah, so it's like never lose sight of
Exactly.
the whole point of what's happening. Dr. Silver, what do you really hope people take away as they head out? Kind of, the parties are starting this weekend, all through next week. What do you want us to know?
I think it's important to just remember that poison prevention is going to be just as important on Halloween as it is on every other day of the year. I didn't really talk about alcohol as well, but I think that's another important thing to discuss.
Talk
also.
about it. What do you want us to know about that?
A lot of Halloween parties. There's going to be Halloween parties for, college, adults, whatnot. There's going to be a lot of alcohol, most likely, at those parties.
Yeah.
So we get the calls from everything, from people that overconsume alcohol that are having symptoms that need to go into the hospital and be seen. We have people that just call up their friend who's concerned, who's otherwise doing okay. And then, of course, we have children that accidentally will drink alcohol because, especially if it's around and it's something that they can easily reach, kids will, a lot of times it looks like juice, they don't know the difference. And there's some different considerations in kids. We often have to watch their glucose or their sugar to make sure that we keep that up. They might need some snacks, they might need additional monitoring, and so we just have a couple other considerations as well on top of our general medication safety. With adding that alcohol in
I
there.
wish we could just say, oh, we know all that, Dr. Silver, but the fact that you're still getting calls year after year after year, apparently we don't, and we need this annual reminder. What is the biggest takeaway?
I think that the statistics are there for us to learn from, right? You can't argue with those statistics. They're very clear that there are a lot of injuries and very severe injuries on the next coming week. So simply being mindful that your child is not going to put themselves in a place to increase their risk. Because we just know walking on the street next week on Halloween, you have a higher risk than if you were doing it 2 weeks before or 2 weeks after. So get them in a costume that is going to be able to be seen, and then also that they are able to see others around them.
Please tell me you're going to go up on the floors and round today with this outfit on.
It could be a temperature control situation.
Okay, is that for making you wear? That's why I know you're waiting to.
You throw an isolation gown on top of this and a mask, and I might have to make a trip to the emergency room.
Well, I love that you're fun like that. So thank you so much for kind of spreading the joy and kicking
bet.
off this weekend. And Dr. Silver, thanks for your insight as always. Appreciate you.
Yeah, thank you guys for having me.
Thanks to our viewers for being with us. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update, Michaela Stover knows the odds. She is more likely to develop breast cancer, but she's not just waiting for a diagnosis. She's taking action. I'm Jessica Lovell on the next Morning Medical Update. The tools and tests available at a high-risk breast cancer clinic helping women just like Michaela. Plus, how to know if you are at high risk. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.